Hi, I am Dr. Oras Alabas, a research associate at BADBIR, University of Manchester, United Kingdom. I am the lead author of this study, which was accepted for publication in the British Journal of Dermatology. Why did you do this study? The majority of information on effectiveness and persistence of non-biologic systemic therapies for patients with psoriasis are from randomized clinical trials. Clinical trials are considered the gold standard to assess treatment effectiveness. However, they are often restricted to small sample size, short follow-up, strict inclusion criteria, and therefore do not necessarily reflect real-world clinical practice. This is why our aim was to determine the real-world effectiveness and persistence of acitretin, ciclosporin, fumaric acid esterase, and methotrexate in patients with moderate to severe plaque psoriasis, and to evaluate potential risk factors associated with treatment ineffectiveness. How did you do it? We used data from the British Association of Dermatologists, Biologics, and Immunomodulators Register, or BADBIR, a nationwide register designed to assess the long-term safety and effectiveness of systemic therapy in patients with psoriasis in the United Kingdom and the Republic of Ireland. We define treatment effectiveness as achieving clear or almost clear skin psoriasis, and drug persistence or drug survival as the duration between drug initiation to discontinuation associated with either ineffectiveness, occurrence of adverse events, or other reasons. We then conducted a multivariable logistic regression model to identify risk factors associated with treatment ineffectiveness and survival analysis to describe drug persistence. What were your main findings? We found that non-biologic systemic treatment were only effective in up to 1/3 of patients to achieve clear or almost clear skin psoriasis. We also found that previous non-biologic systemic therapies, male sex, the presence of comorbidities, and alcohol consumption were risk factors associated with treatment ineffectiveness. Our survival model showed that methotrexate had a better persistence compared with the other 3 treatments. Why is this study relevant to dermatologists and their patients? Non-biologic systemic therapies are used frequently in the treatment of moderate to severe psoriasis, in part due to the low cost, but are only effective in up to 1/3 of patients. By considering these findings, we hope that the guidelines on these therapies in the management of psoriasis could be revisited to include expected levels of effectiveness and reasonable time frames to ensure patients are not left on suboptimal therapies.